Good morning. So, we are continuing the lesson that is yoga, and we are discussing the lifestyle diseases, their prevention and management. Prevention and management of common lifestyle diseases. So, we have discussed about obesity, diabetes, hypertension. Now, we are discussing about the back pain. Back pain is another very common and very serious problem, very serious lifestyle disease, and most of the people suffer with back pain problem. So back pain is a common problem all over the world. It generally originated from the bones, joints, muscles, or nerves, etc. The root cause of the back pain may be due to the bone, the spine, or the backbone, the spinal cord. It may be due to the joints of the spine, vertebrae, and in case of lower back pain, it may be originated from the joints of the girdle, and it may be muscular pain. It may be associated with the nerves, because the backbone, the spine, is very sensitive part of the body. So most of the back pain originated due to this dysfunction of the spine. So it can be in the cervical, thoracic, or lumbar region. As we know that the vertebra, the spine, is divided into 5 segments, 5 parts: cervical, thoracic, lumbar, and coccyx. So it may be associated with cervical, thoracic, and lumbar region. It can be constant, stay in one place, or radiate to other parts such as arms, hips, or legs. Mostly the pains associated with the spine, they radiate to the different parts of the body. They may affect the functions of arms, legs, and other parts of the body also. So back pain may be mild to severe. The affected person is unable to do work efficiently and smoothly. Reasons of back pain may be wrong body postures, lack of physical activity, overweight, excessive smoking, lack of flexibility, or undue stress on back. So, as the name is very simple, back pain, but the back pain can cause serious problem when it is not treated at initial stage. And if it is associated with the spine, it is originated from the spine, so that is more serious condition, so we have to take it more seriously. There are a lot of ways of prevention of back pain and their management. Mostly the physical activities are very helpful for preventing from various back pain. The back pain mostly occurs upper back pain and lower body back pain. This we can see here, upper back pain or lower back pain. Mostly two type of back pain is noticed. It is upper back pain and lower back pain. Muscular back pain, due to the muscles, the back pain is not that much dangerous if the back pain is associated or originated from the spine or the backbone. So upper back pain we can see here in the picture, and lower back pain. The back pain is highly painful. This is a highly painful situation. The people who suffer with the back pain, they know the painful situation of this disease, back pain. Causes of back pain we will discuss now. Causes of back pain, most of us experience lower back pain at some point in our life. It becomes more common between age 30 to 50. It is the most common neurological ailment in America, second only to headache. The largest number of people are suffering with the back pain problem due to their lifestyle, especially in adulthood age. Age is the cause. We lose bone strength and muscle flexibility as we grow older. Bone mass decreases, muscle flexibility decreases, flexibility of joints also decreases, joints become more stiff. So according to age is the main cause. Second is obesity or weight gaining problem. People have extra weight, and people are obese. Due to that body weight, they are suffering with the back pain problem, because excess weight put excess stress over the spine, and it reduces the flexibility of the body and joints also. So then this is the another cause that cause the back pain. Arthritis is the disease of the joint pain. Deteriorating collagen and cartilage cause stiffness and pain. The joint, either it is the small joint of the body or it is the major joint of the body. The structure of joint is typical, and the cartilage which work as a cushion between two bones at the site of the joint is damaged, which causes the collision of both bones, sometimes cracking, and it is highly painful situation. So the joints of the vertebrae, especially about I am talking about the spine. When the vertebrae, the 33 vertebrae are there. These vertebrae are when the joints are have problem. They are the joint structure is damaged, or there is stiffness or collagen. In the joint between the bones, it is highly painful, and that can also lead the back pain problem. Poor working posture. The posture is another very major cause for back pain among the people. Habitually bad posture trains the stack of vertebra to be misaligned. As we know, the posture is the proper alignment of the body. So the joint and the bones of the vertebrae or the vertebral column is misaligned, or alignment of the vertebra is, we can say, disturbed. So poor posture is the another very big cause, a major cause for the back pain. And we have discussed in the posture chapter that it leads various postural deformity when we are not having good posture of working or taking rest. It is not about while we are working. Posture of body should be always good while we are sitting, while we are standing, while we are walking, while we are working. So the posture is the poor posture is another cause of back pain. How to prevent the back pain? In one of the tests that I was studying in Cross-Weber physical fitness test, that is mostly the people perform crunches, bent knee sit-ups, straight leg sit-ups, have delayed or they prevent more carefully the back pain more properly than other persons. There is a psoas muscle, PSOS, psoas muscle, that is slightly situated below the sternum, is highly responsible for the various back pains. Thousands of type of back pains are there. Very few type of back pains are associated with the spine, but there are thousands type of back pain which can be cured by various type of physical activity. So first is regular exercise. prevention of back pain, the regular exercise. Regular exercise are helpful in enhancing strength and keeping the body weight in control. So, regular exercise, first it will make our body, the muscles and the bones of the body strong. Second, it will keep our weight under control. So, that's why it can help to prevent the back pain. Aerobic exercises are considered best as these exercises do not strain or jerk the back. Along these exercises, the flexibility exercises such as bending forward, backward, bending forward, bending sideways, and sit ups should be performed regularly. That bending forward exercises or various exercises, in which one of the crunches that I was discussing, straight leg sit up, bent knee sit ups, also very beneficial for the back pain. So regular exercise is very important for preventing ourselves from back pain problem. And especially the bending exercises are considered very good for preventing ourselves from back pain disease and back pain problem. So various exercises we can see here. These are being performed. So regular exercise is there, first one. Second, we will discuss maintain appropriate body weight. Overweight and obese persons are at the greater risk of developing back pain. To maintain an appropriate body weight, regular exercise and balanced diet are mandatory. So weight should be under control, because the weight put excess stress over the joints, over the muscles of the lower back and upper back. Weight also disturb the balancing of the body weight around the midline of the body. So appropriate body weight should be maintained. So this can be maintaining the body weight is possible by the regular exercise and balanced diet. And understanding intake of calorie and consumption of calorie. Calories should be taken according to the workout, and intake of calories should be mostly equivalent to the consumption of the calories. Third one is proper sitting posture. Proper sitting posture is mandatory for prevention of back pain. One should sit with erect and straight back on chair, and feet should be flat on the floor in sitting right posture. There will not be undue stress on the back, which is beneficial in preventing back pain. When we sit in a wrong posture while walking, while taking rest, the spine get extra stress. It is stressed, which further leads the back pain. So keeping the body posture while sitting is mandatory for prevention of the back. So body posture we can see. The first one, wrong posture. The body is not erect, it is bending forward. Second one is the correct posture. While we are talking about the posture, we must know about the curves of the body. There are the curves in our spine, and these curves should be maintained. Don't disturb these curves. The spine has natural curve. The curve we can see at the neck, the curve we can see at the thoracic region, the back, middle back we can see there is the curve, lower back we can see there is the curve. So these curves should be maintained. While we are doing any work, while we are sitting, while we are taking rest, we are disturbing these curves. We are changing these curves. That leads the postural deformities and the problem of the posture, and which can further convert it into the back pain. Another one is proper standing posture. Standing posture we can see again here in the picture. We can see the correct standing posture. Should be there. First one and last one we can see that is the wrong posture. We should see the midline of the body, and middle one we can see that is the correct posture of standing. Proper standing posture, one should keep back straight and balance body weight evenly on both feet while standing. Toes should be 3 inch to 4 inch apart. Knees should be straight. What is the way of standing? Proper posture of standing. That is, the body weight should be equally divided on both the legs, both the feet while standing. Toes should be apart. 3 inch to 4 inch from each other. Knees should be straight. And while we are standing in a correct posture, we also feel comfortable. We should not make a habit of the body put on rest on the wrong posture. Fifth one is avoid lifting heavy weight. Lifting heavy weight also sometimes cause the back pain, especially originated due to the muscular and joint problem. It may be the joints and muscles of the spine also. Lifting heavy weight without using proper technique cause injury to the back. Keep the back straight, head up, squat properly, and then lift the weight. Keep the object close to the body. Don't strengthen the legs before lifting the weight. Weight should be lifted properly in a proper position. Or if the weight is so heavy, so we can use certain techniques. Or we can take help of any technology. So lifting heavy weight, and weight should be always, we should always lift the heavy weight just after warming up. Get your body warm. Suddenly we should never lift any weight. Sometimes the weight we are capable of lifting, that also cause sometimes the back pain, because we are lifting the heavy weight or the weight suddenly without bringing the body and body parts into the movement. So avoiding the lifting heavy weight, avoid lifting heavy weight. This also cause sometimes the serious problem of the back pain. Then another cause we will see here, use lumbar support belt. Lumbar support belt that is used at the site of the lumbar spine. The person who are engaged in lifting weight should use lumbar support belt to avoid injury to their back. The person who are engaged in lifting weight, heavy weight, they are using lifting the heavy weight frequently, so they must use the lumbar support belt. That is, we can see here in the picture. This can help, this will give support to the spine, and it will protect the injury of the joints and muscles of the lumbar region of the back. No smoking. On the basis of the recent research, it is concluded that the higher percentage of smokers have more back pain incidences in comparison of non-smokers of same height, age and weight. So smoking affects our nervous system, and that leads somewhere, that is affecting the nerves of the body, and which makes our nervous system weak. That can also lead the back pain problem. In yoga, we know that most of the nerves are passing through our spine, and if there is any deformity of the nerves, that may lead the back pain problem. It may affect the functioning of the spine. So another preventive measure, that is no smoking. Another prevention, then we can see laying or sleeping on bed. How we should lay down, or how we should sleep over the bed. Use the mattress that keeps the spine straight and normal size pillow, so that neck is not in the steep angle. A hard mattress is preferred. People mostly use heavy and larger size pillows, which makes the steep angle at the neck, in which neck drop forward, which disturb the curves of the spine, and that may lead to the back pain problem. So we should use the mattress or the pillows that should be not higher, that should not be heavy, and hard mattress are preferred. Hard mattress will be not comfortable as much as the soft mattress are there, but that is beneficial for health, that can prevent us from various muscular and various spinal problem. So laying or sleeping on bed should be in proper posture. Refrain from strenuous activities. Strenuous activities lead fatigue. Walking under fatigue may lead to back injury. So while we are doing high intensity activity, we should always be highly active, or we should be fatigue free. During fatigue or tiredness, the there are most of the chances of the injuries, especially back injury, is very common while we are working under the tiredness condition or fatigue condition. Move and lift the object properly. Pushing object instead of pulling it. While lifting an object, look straight ahead, not up or down, to keep one's back and neck in straight line. So we have to be very careful while we are lifting or pushing or pulling any object. Pushing is considered safe than pulling. So we must be very careful. The body should be warm, and the body should be in proper posture, straight head, straight back, and neck should be straight in a straight line. That will reduce stress to the spine. This is all about the prevention. These ways can help us to prevent the lifestyle disease back pain. Now we'll see the management steps, how we can manage. If the person is suffering with the back pain problem, so how we can manage the back pain. Management of the back pain. Aim is to achieve maximum reduction in the intensity of the pain as early as possible. Initially what we try to reduce the pain. Then the treatment at the root of the back pain, so that the affected person may restore his strength to perform daily routine activities. It can be managed with various therapies and corrective exercises, and sometimes surgery is required in rare cases. So what are the management steps? First is heat therapy. Heat therapy reduces the pain. Hot bath के best result, steam bath, sun bath. So that is the heat therapy. Heat therapy reduces the pain. This is most common since ancient time. Hot bath gives the best result. Hot bath in the form of we can take steam bath, we can take sun bath, and we can take the hot water bath. Hot water that our skin can bear. Cold compression therapy. Back pain is relieved by cold compression therapy, ice packs or cold packs also. It depends to the type of the back pain, for which we must consult to the doctor or physiotherapist. Cold compression therapy is also very beneficial. For cold compression therapy, we must consult to the physiotherapist or the doctor. Massage, it is very effective in relieving the pain, but must be performed by an expert and under the guidance of the physiotherapist. And doctor, the specialist. So massage therapy is another very common to reduce the pain and helps to restore the strength of the spine and the muscles associated with it, which are responsible for the back pain. Another one is the medication. Medication, it is beneficial in reducing pain, especially muscle relaxant, may be effective, but only for short time of period. The muscle relaxant and topical analgesics are given. The spray, now these days sprays are also available. Like mostly we use the Move, Iodex are very common here. Pain relief, Volini, various products are available in the market. Muscle relaxant, so they give the relax and they delay the feeling of pain. They are only used from outside, and but they are not used for long term. They are only for short term. The effect is only for short term, and this is not a long term therapy. For further medication, then consultation of doctors and physiotherapist is required. Physical exercise, stretching exercise such as bending forward, bending backward, bending sideways are very effective, especially asanas, yoga asanas such as Tadasana, Savasana, Salvasana, Bhujangasana, Dhanurasana, etc. can be used for managing back pain. Physical exercises can also be beneficial, but should be done under expert supervision. For managing the back pain, we also take advice, or we should always perform physical activities under the guidance or supervision of the expert, yoga expert, physiotherapist, and doctors, especially orthopedicians, who are the experts of the bones and muscle. Surgery, though its requirement is rare, but can be very effective for individuals with major disc problems or scoliosis, that is postural deformity, in which the spine is shifted sideward, and disc problems are there, that we know, spondylitis, and lower disc problem, that is sciatica. So various disc problems are there, in which the vertebrae are deformity of the vertebrae in the vertebral column. So surgery is needed rarely, but when it is needed, so it is highly effective, but it should be also done by the expert surgeon. Other therapies, electrotherapy and inversion therapy, are also used to manage the back problem, but these are applicable for temporary relief. Electrotherapy, light therapy is given, different colors like color light, and inversion therapy, in which the therapy is given by different kind of equipments. So it can manage the pain, but not it is for longer duration, it is for short term therapy. This is all about the back pain. So we will come with the another topic in the next video.